Medical disclaimer. Please note that the information shared on this podcast is for educational and informational purposes only and should not be considered medical advice. Always consult with your healthcare provider before making any changes to your health regimen, including starting new therapies, supplements, or treatments. While we discuss cutting-edge research and advancements in cellular medicine, individual health needs vary and professional guidance is essential. By listening to this podcast, you acknowledge that neither Dr. Seeds nor the podcast team is providing personalized medical recommendations.
On today's episode of Redox Revolution, yes, it's more couples therapy. Here we go. Welcome back to Redox Revolution, and Matt, you're still here. Maddie, you're not. Oh, but Carl, Terry, you're here with us. Let's get going.
If you haven't listened to last week's episode where we introduced the Paiges and kind of walked through their process into getting into this field of cellular medicine, definitely go take a peek at that one, because we're going to start diving into some very specific questions. Some of the things that you guys are interested in that you're doing today. Like, I'm just going to rip the Band-Aid off right here. I know, Dr. Paige, you're very interested in how quantum biology reveals electron behavior, tunneling, and coherence shape physiology. So that's a question just to wake us up. That's an adrenaline shot in the arm. Tell us what that's all about.
You know, like Terry said, I've always been interested in why something works and ticks, and I used to get things and take them apart to their minutia and put them back together, and always happy when you didn't have one or two little screws left over. You did a pretty good job of reassembling it. But in part of in what I do for practice and working in the cellular medicine space, really I was just always looking for that next level. So peptides kind of got us into this space. Everyone knows what peptides are now, and as little signaling tools. But what happens below that level? What happens at the cell when things are communicating with the cell membrane? What makes that cell membrane happy? How does stuff get from the cell membrane into the nucleus? And what about that process? And there's a whole lot of quantum biology that it helps explain that, because really otherwise you're just what I was thinking about when I did this is when we went to medical school, we had none of the nice, high-quality 4K 3D imaging representations of things. We had Tinkertoys, like some styrofoam balls and sticks, and you had to try to somehow conceive how these processes were happening at a quantum level, and it was very difficult. I have to say I didn't have a good understanding of that at all. But as now we've got better audio visuals to grasp that, and understanding spin and tunneling and coherence and decoherence and all these different concepts in quantum biology, I feel like I've got a much better grasp of them now, just from how does that actually work at the cell level, and then now I'm in the process of trying to learn what type of things in our toolbox we have that can help augment that process at the cellular level, because we all know about redox potential and pH and how these global things can help a cell work better, but how can I make that cell work better at a quantum level? And that really got me into the sort of physical things that might impact a cell. So the things I came up with were the common physical forces, like gravity, or magnetism, or light, sound waves. How do all of those impact how the cell works? And so that's what dug me down that rabbit hole. And I'm still digging the hole. That's what I'm going to say. I've not found the bottom of it yet. But.
So I'm going to grab one of those words out of there that you mentioned. So cellular coherence, what is that? Why is that important?
It's just the process of, at least the way I understand it in my limited exposure to this, is how different aspects of cell physiology will collude together to allow a process to happen. So that's coherence. Or you can have decoherence, where they are not colluding. That's a simple way of thinking of it, at least in my brain.
So I look at coherence as, you can't look at a cell as this reactor. It's a constant. There are constant forces that are changing in a cell, and it's really around these protons and photons and it's about you're talking more about quantum coherence, which is about it's about spin alignment. It's about it gets into spin alignment. It gets into things about the charge, spatial charge, and it gets into things about electron flow, because it's really focused, in my opinion, in where I've taken it in explaining it from the cellular medicine side, is really based on the coherence in the cell as far as electron flow, membrane potential, and then cellular redox, and how those are the components that make up the coherence of the cell. And when you lose coherence, you get dysfunction. And that's where we then brought in peptides and how they can change electron flow. They can change cell membrane potential. They can change redox. And it's all of those things together that he was talking about, discoherence or coherence. That's what makes up the essence of the beginning of understanding quantum mechanics in a cell.
So when coherence is preserved, then you have a mitochondria operating efficiently.
Correct. Yeah,
Okay.
yeah.
Absolutely.
Yeah.
It's a nice way. It's a way of just bringing in some quantum physics and understanding, hey, we're using it already.
Yeah.
Hey, this is what we're doing today. And then and then the next step that you've seen are people bringing in stuff about photo emission and this things about how light can change aspects of the membrane potential of the mitochondria, where they can work on cytochrome C oxidase.
And that's where I got into the physical properties, light and gravity and magnetism and sound waves. All of these things there's an oscillation in the cell. It's not just a static structure. I always thought of it as just this picture of the cell wall and the organelles and everything's sort of fixed and static, and it's extremely dynamic and oscillates and hums essentially. And
well, that's the essence of circadian rhythm. I mean, circadian rhythm, the circadian clock's the beginning of understanding the quantum coherence of a cell. That's it. I mean, you got to get that part. That's what sets off the coherence of the cell. That's what sets off the very beginning of all of what we're discussing here.
So we've got peptides that can work in that space. This it also connects the dots of a lot of the earthing, grounding, working with circadian rhythm, the intentionality we mentioned earlier in the last podcast, that the whole, how do all of these forces impact the cell? I mean, it's a very wide open space for me to dig up a hole in, is what I'm telling you, try to figure this out or make some connections there. But
there's more, and I think it's getting the validity, the scientific validity behind it. So we started... Cellular medicine was based off electron flow and cellular membrane potentials and redox changes, and that got us started in that space. Now, these other things that are trying to influence that, they're developing. You're starting to see more science. You have some mechanisms explained, but is the science there yet? No.
No, it's not there yet. But something's happening in that space. We have a direct dots connected? Yes, I don't think so at this point. There has to be some mechanism for that impact of just day-to-day life choices, or intentionality, meditation and prayer, all these things. How does it impact outcome? And it really the dots are connected to me through quantum physiology. But we have not put the dots together yet to give you that pathway yet. But there has to be some way they're connected.
Well, I think the answer is it affects electron flow, membrane potential, and redox. That's the key to the cell.
Yeah.
So all of those things have that influence, and it's coming down to, well, what are the instigators of that? And I think a good thing, when we had Leah on the show here earlier, Leah was talking about the brain connection, and we brought in the science part of these of what we know. We don't know what starts it, but you talked about intention and thought, absolutely creates these molecular associated patterns that are real changes that have receptors for them that influence just what we said in a cell, mitochondrial function. And that can be in the brain, it can be in the immune system. It's really delineating out that
It's practicing an outcome, and it's no different to me than learning to play an instrument. You spend time making all of these neural connections and touching something and listening to it, and here's what comes out at the other end. And you do it over and over again until those pathways become sort of like a reflex arc, as opposed to they have to be conscious thought at that point. And that is the same way, really, from an intention standpoint. It's just not directly a neural arc reflex. But I believe that their cellular pathways change as you do that.
So speaking of bridges and connecting dots, like Terri, I know you're a certified lifestyle coach, right? Mm-hmm. And how has that background helped you to kind of help be that bridge between people saying stuff like this and I'm not following it? So it's almost like if I'm your patient right now, how are you helping me to bridge this gap in understanding?
Yeah. That's a great question because it's fascinating for me to listen to.
Yeah.
And just because I've been around these fellows for a long time, I've got some frames of reference. But, the average patient that walks in the door has only, I feel terrible and nobody's been able to help me. What are you going to do different? And I think back to your point about, I think the end point is super important. Really, when we talk to folks, it's about asking some really powerful questions first. What is it that you want to achieve? And then what will success mean to you? And what does that look like? How will it show up in everyday life? Because when you can get people to see that over there, okay, well, success to me looks like I won't have to stay in bed most of the day. I'll be able to get up and play with my grandkids. I'll be able to take my kids to soccer practice. I can cook my own meals. When they start to think like that, they don't know how they're going to get there, right? There's a path to get there. Then that's something, though, that you can anchor to and say, okay, here are some steps. And they don't have to understand the quantum pathways on how that works, but they do need to understand and have trust. We have to earn that trust with some little small steps. I always like what you say, Dr. Seeds, about, hit one little home run. It might not be what you really want to do, but find one little thing that will give people success. Maybe it's just, I don't know, pulling Cokes out of your diet, something like that, something that just all of a sudden you feel and then work from there. So it's about trying to build that with the background that I get to hear here and then making it into some actionable, more digestible steps.
Yeah, because I know you guys are also huge on, you just said it, that personalized plan of care for their journey. And so I guess what you're saying is to help them kind of understand the value of why that's important, and you're not just handing them a protocol. You want to start to make those wins tangible, show them that things are possible.
Yeah, you want to hit a few home runs early on.
Well, we found that we all love peptides and different things we can use clinically that we have available now, but if you just show up to a patient and hand him 10 different peptides and say, look, go try these in a few weeks and call me back if you feel better, most of them don't execute well on that, or they're so overwhelmed with it that they just kind of give up. They're already usually by the time they get in our office and been around the mill of every clinician in town and sometimes places out of town, tertiary care level places, and they're at the end of their rope. So they do need something to grab, a lifeline almost to grab onto. They need validation. We've got to acknowledge what their real problem is, validate it for them, tell them that we are interested and can care, and then give them a pathway to get there. But if that pathway is too complicated and overwhelming, they just will fall off the pathway pretty quickly.
We call that in the office here, we call that those are the people that give out the Skittles. It's like, oh, here you go, and this is going to make you better. It's
about how people always are looking for protocols. I think, oh, tell me the protocol for this, tell me the protocol for that, and it's not that simple because it's nuanced.
Well, and it builds.
Right.
Like you said, you've got to find your wins, and you've got to build from those. So that's why it's not the same for everybody, and it's why you don't. It's why you have these people that come to you who've been to those Skittle docs.
Skittle docs.
I like that. I want to remember that one.
So let's try to build some wins then. I know we're saying, each approach is individual, but like with all the modalities you guys have integrated, you just brought up peptides. do you have any like go-to peptides that it's like, all right, we're going to start to build in some wins here that are just
It depends
really
on
good
the presentation.
Yeah, so maybe then let's go through a couple examples then of just an overall cellular medicine approach. What are some of your go-to peptides?
More common things are the two simplest ones that I'll pull out in most cases, if we're just going to generalize, would probably be thymosin alpha-1 and BPC 157. Those are probably my core peptides. That there's a reason I can use those in most patients if you want to try to generalize and not get into any trouble too, when you're going to use them. I think that's probably the two I would pick.
My biggest is Cellular.
Yeah.
That's my I can't say enough about it in where and again, it's what type of people are you seeing, right? And it all varies, right, in the type of physician and people that you have in your practice. But for me, Cellular, and then I would go with the TA1, thymosin alpha-1 that you said. But there are so many that you can pick from to get your wins. Like sometimes you can't start that way, but
what would be an example of why you couldn't start with one of those three?
Again, it depends on some people. So like if I pick Cellular is usually like for my patient, for a lot of my patients that I see, they're highly stressed. They've seen many physicians. They've gotten no answers. And that, besides what they're presenting, the main reason they're presenting for it, that anxiety issue itself adds a great a hump that you have to get over to even get started to get the appropriate treatment plan or to even get them in the right frame of mind that, hey, you are a little different or you can do some things to help them. And so in my practice in that type of patient, the Cellular can be invaluable because its effects on BDNF and BDNF's effects on reducing agitation and anxiety and so forth. And so I know typically it's a win with no negatives. It's like
and it's a nose spray too, so it's like you didn't have to have them stick a needle in themselves. So it's always,
exactly. It's an easy step for them to take that leap, right, and to be adherent to your plan. So if you have someone that isn't in that in that category of where you believe, and it's all comes in the discussion with your patient that Terry's been talking about, and getting to know your patient and so forth. Well, then you don't need to start with something like that. It could be you could be going right at metabolism. You could be going at the immune system. You could be going at the microbiome. It's nothing you have to be. It's how you make your decisions.
Yes, starting places. You guys do light therapy, right?
I don't.
Red light, blue light.
We use red light a lot. Yeah. That's probably our biggest one.
Mm-hmm.
Yeah, we usually have the patients self-direct that because it's so cost effective for them to get for joints and skin, and we set them up. A lot of them are lucky and have their infrared sauna with a red light panel, but not everybody has that.
Well, and other ones then would be the high fem and then the ultrasound and the RF and things like that you've been using a lot of lately.
Yes. We use a lot of pulsed electromagnetic fields targeted to brain or joints or muscles, and combining those with peptides is really part of that whole quantum space. Is how do these physical properties interact with the cell, to enhance uptake of whatever plan we're going to implement, whether it's diet, lifestyle, exercise, peptides. Using those tools to get a better outcome has been like we've been using some cerebral icin in a guy's arm who had a traumatic arm injury when he was 18. But we were using it in the nerve, hydrodissecting it into the nerve, and then using the EMF to get his muscles back in his hand, and he and sensation both have returned. It's not normal, but he's got much better use of his hand that he wasn't able to use for quite some time.
Has there been anything that you guys have tried to bring into the Medical Transformation Center that's just been a complete waste of time and money? I'm not saying we should just shoot some strays here, but like, I feel like it's always a big game of trial and error, and you really only get to hear it from other providers when you're like, yeah, we didn't really have a lot of luck with
There's
that.
a lot of stuff you can waste a lot of money on. Then it's like when you go to one of the big conventions and see the room full of, millions of dollars worth of a lot of it's junk.
Well, specifically, I will tell you, you know how sometimes you'll have intention, but it doesn't come out right. So these devices that we were just talking about that have these different energy properties to use, the RF, the HiFM, all of that, we brought those in with the intention of doing exactly what we are doing with them, which is remodeling tissue, helping people with their core strength so they can age in place, helping to rehab people. We brought it in with all those intentions, right?
Yeah.
But the marketing material and the bent that we started with was very directed towards aesthetics, body sculpting or things like that, which is not, I will tell you that's not what we do. Now, do we love to look better? Absolutely. We do. And do our patients, once they start to feel better, want to look better? Yes, they do. And so we do use those for those folks, but this is just you asked us about bloopers, right?
Yeah,
okay, so this is a mistake that we made in positioning those services using the tools that were maybe given by the vendor and what we thought, we really want to grow at least some of this. We're not competing with med spas or things like that, but we want to say, hey, we've got these great tools.
Yeah.
And that, I will tell you, that fell flat. I mean, it did
we
because
mismessaged it,
we
I
did.
think.
People thought, wait a minute, are you not doing the other stuff anymore? Have you turned to a med spa? Are you? And that was not our intention at all.
Yeah,
and we
so
had to course
interesting.
correct that because it was just like, no, wait. We really are who we are, our core. Yeah. We just, and we mismessaged that. So, that was...
I think no disrespect to the med spas and stuff and using some of these modalities, but they don't have the total knowledge base of, or even the people representing these things that are just, I think it's all a money game. I'm just going to be honest on that. In how they can expand. It's a good device, but it's just, how do I expand this? How do I get this in the market more? Yeah. How do we make this look more sexy? Well, you guys are really focused on cellular medicine and the fact that what are all these things doing? We're talking about improving efficiencies that eventually lead to an efficient mitochondria. That's what all of these things are directed towards doing. It's not, it's all of those things. And when you have the messaging like what you just said, it's like you lose that hierarchy of, hey, we represent the real part of this, not the quirky part of what people are trying to sell you on.
Just a quick fix, body sculpt. You don't have to work out in the gym. That was never our intention, but
because that's total bullshit.
Yeah, it is bullshit.
Yeah.
And it's a tool. It's a tool in your toolbox, as you had said, to make what you do even better because you understand it. But when people just use it as a, hey, this is how we're going to make you look aesthetically great, it's like, really? I mean, come on, guys.
Well, it's just like GLP-1s, right? Just like GLP-1s. You guys have been talking about these forever and how they help with efficiency and cellular efficiency and all those things, and then it gets hijacked.
Yeah.
And then it's a quick fix.
Yeah.
Well, I tell patients they'll come in, because they have a lot of negative connotations of GLP-1s now when they come in the office.
They got to read my book.
Yeah.
Yeah.
Well, and I'll tell them, look, there's 8 places around town. If you want to go there, they'll give GLP-1 to a 17-year-old to lose 8 pounds to get in her prom dress. I said, that doesn't mean that's appropriate use.
That's a good one.
of the medicine, right? It's not selected appropriately for them. And they might have side effects if you choose to use it in an inappropriate setting. Yeah.
Absolutely.
It's almost like just thinking about the messaging and the mismessaging, you can kind of see the similarities from the practice level to like the institute level. I mean, that's why we've always just had the invite only for the partner network and everything with the SSRP Institute. It's the same thing because we want to be able to control that implementation in the messaging. It's not we're not just going to open this up and have people be confused and it's like, you're not doing it the same way anymore. It's, no, when these guys are involved, They're involved for a specific reason because of the approaches we're talking about, and these people can help us with those niche targeting, or with that niche targeting.
Yeah. Well, I think when you approach everything from the right standpoint, it makes these modalities what they're supposed to be. I mean, like, let's start with, let's just look at red light. Mm-hmm. Where did red light start? Where was it initiated? Why did it come into this country? What was it utilized for first? It was used in the physical therapy world for wound healing.
Yeah.
And when those devices came in, it wasn't just that you went into physical therapy and they just hit you with the light and said, see you later. They were working on range of motion. They were working on strength. They were working on action potential processes, not electric galvanic stimulation, but real action potentials on muscles. So they were doing all these things, and then that was an extra part of the modality, just like class 4 lasers. And that made a difference. It wasn't by itself. And so that's how this has gotten so misconstrued, because people say, you do this laser and we're going to change your life. And it's like bullshit. Or you do this photo modulation. And then it's taken to further extents, right? It's like they don't understand that there's only so much tissue penetration with some of these modalities, especially the light therapy. That's the difference between blue and red light, by the way. And that they try to make more of a statement of overall health, how this is going to, well, look, the research right now only validates soft tissue injury. That's it, okay? There's a reason for that, and it's because it only penetrates so far. So there's more to come. It's getting better in what it's being able to do, but I think you guys bring up that it's so interesting how you guys saw that and you didn't want to be part of that.
Yeah, it was just it was the first time we'd ever bought devices, but we were so excited because for what you were saying, they really could help people function better and live better.
Absolutely.
But and a lot of times from the device companies, right? You get the marketing material, you get the banners, and that just my goodness, that was definitely a lesson.
We had to do a reset.
Yeah, that was a lesson.
I'm happy
there.
we have them. They are very effective. I mean,
but that's brilliant just to hear that. That makes me feel good. That you guys you had all the right intentions, but then you saw. You felt cheapened.
Yeah, exactly.
Yeah,
that was
much.
it.
That's
I mean, and again,
it,
no disrespect to your point.
No, you're making
to
it
folks
clear.
that
It's
are
a good
doing.
device. It's a good company, but it's just how do you make it the right message and how do you keep it targeted?
It's not what we were about.
Because
we
it's up to you. You're the only one really, and I'm not saying anybody else isn't, but you're the one who has that relationship with the patient and that patient's trusting you to give them the right messaging. That's why they come to you.
Yeah.
And it's so awesome to hear this, that, hey, look, we're not about this. We're about representing a patient. We're all about the patient. And that's what separates, I think, all of us, and especially cellular medicine. It just nullifies all that bullshit.
Mm-hmm. So when it comes to the patient coming to you because they trust you, do you have any specific communication strategies when maybe the first time they are coming to you, they're coming at you with like their stack of papers and they're like, here's all my tests I've done, here's all my biomarkers, I'd like us to look at this, this, and this. Like,
and ChatGPT.
Oh, yeah. I had a 17-page paper the other day from Chat.
Yeah, and a
Good
bunch
thing
of different
Chat
SNP panels they
supported
bought from
what we
somebody
told them,
online.
Yeah.
what do you guys do when someone comes in with all of that?
I'll tell you on the front end, and then you tell them on when they get to you. On the front end, what our team tells folks is, we appreciate that you have all that great information.
Yeah.
Dr. Paige may want that at some point, but really he likes to start with a blank slate. So come on in, start to share your story. That way he's not biased. He doesn't have a bias based on what you've done already. And then he may ask you, okay, we want to put this in your file, or, oh, you've already done that study? Let me see that. So that's how we approach it on the front end. So
That's a great
if
framework.
they get back to you, what happens?
Well, I try to be conscious of they may have put some type of an investment into this, financial asset. Listen,
You don't say, Terry, why did you send me this person
Yeah.
with all these damn
No.
studies? And
They've been everywhere. Remember, they've been
you don't
trying
have a
to
button
help
where you go,
advocate
Terry,
themselves.
what is this?
we put it in the chart and tell them that we'll keep it and reference it if we need it. But I tell them, listen, if that gave you the answer already, then you don't need to be here.
Right, you'd be better, right?
Right, you'd already be better.
It's like you had all this stuff done and you're here to see me.
Yeah.
What's going on?
So I'll be conscious that if they've done some giant, neuropathy panel that I might want to pull something out of and see to validate something, I want to have that data as opposed to duplicate it for them. But we start with a clean slate. In fact, I almost don't even want to look at anything they wrote in there because they've already got a lot of preconceived notions about what they think's wrong with them, and I'd like that to not be in my head before I make an assessment and evaluation. I'll go back in references to see if it correlates with anything I'm thinking, but
the patient has to appreciate that too, right?
Yeah.
They're coming to you for your approach.
Yeah.
And you have that information if you choose to look at it or use it later, or if it has some value, great. But you're really starting. I like what you said, a clean slate.
Yeah.
I mean, that's what people they're looking for that because
there's so much stuff that you can buy off the internet now and order on
gosh,
yourself
yeah.
that there's a reason you can access it as a medical provider and order it. I mean, rarely does that give me the answer of what's wrong with anybody. I can tell you that. I mean, it's probably never.
Well, all of the, as we've discussed, and we have, and I'll bring it up very briefly here, there's no standardization of any of these tests across the board. So you really got to be, and can they be helpful? Are they sensitive, but are they specific? Well, they may be a little sensitive, but they're not specific. And it's like, how do you use that information, right? And that comes down to your art,
right,
and how you do it.
That is the artistic piece of it,
right?
I mean, yeah.
I love hearing that.
On every episode, we try to do a performance protocol, something where it's, hey, you can implement this tomorrow morning. It's not necessarily something you have to go out and buy. Maybe sometimes it is, but it can't be that expensive. Like, somebody needs to be able to do it tomorrow. And this is kind of perfect because we didn't do one last episode while we were doing introductions, but we can do two here. If each one of you kind of had to narrow your scope in all of these years of practice and patience and down into one, like, this is the one thing I would just tell everybody to focus on and make sure they're doing, what would it be? And we'll do ladies first.
Well, if it's one thing that you can do no matter whether you see us or not, and it's not going to cost you a lot other than what you might normally spend, I would tell people to change their diet, to pay attention to what they're eating, read the labels, start to pull the artificial junk out of there, the diet foods that are supposed to keep you healthy and keep your sugar in line, they don't. That's what I would do. I would say clean up your diet, pull out the artificial sweeteners, try to eat as minimally processed, eat real whole foods, get enough protein, get lots of good vegetables, minimize all the grains and the carbs and all of that kind of stuff. I mean, use them judiciously, but, anybody can do that if they just educate themselves.
Was that a big focus for you back when you guys were first taking this diet?
It was number one. As a matter of fact, that day at our kitchen island when I called him on the carpet, when he came back to me, what he said was, I've been reading. He had a book. It was 2008. He had a real book. He said, I've been reading, and I don't think I can help you unless you change your diet. And if you change your diet, I'll bet you that as your gut starts to get healthier, a lot of your problems will go away. And he was right. Oh gosh,
wait.
Can we
freeze
did I just
that?
say that on a podcast?
Yeah.
I am on record as saying he was right.
Carl, we can repeat that over and over for you.
You're right.
Hang
You're right.
on
You're
to
right.
that
Right.
one, buddy. Hang on to that one. But he truly was.
Line and sinker. I will take that Venmo now. No, it's interesting. And it's the reason why I know you're not just like picking something out of thin air is because being someone who's actually gotten to step foot inside your practice For anyone who doesn't know,
Oh my
the
gosh.
second that you walk into the waiting room, if you look to the right, there's just a giant. I don't want to say giant or industrial, right? Because it's still
beautiful.
very
No,
personal. It's beautiful, but it's huge.
It's awesome.
You have this big kitchen right there at the front of your clinic.
I
And
think
what
they
do you-
should see patients in that kitchen.
What do you guys? Yeah, tell people
Well,
about how
we
you
have the
utilize that kitchen.
So the
beautiful.
kitchen is right off of our waiting area, separated just by a glass wall
Yeah.
with doors. And it is our break room. So it is where we eat and rest and that type of thing, which sometimes can get a little, uncomfortable if a patient walks in the door. The big cooking surface with the hood and the big refrigerator, and it's to symbolize and also to do. It symbolizes that it's so core and central. The kitchen is the heart of the home.
Yep.
It's how you nourish yourself. If you garbage in, garbage out, right?
Yeah.
But then also, it's there to help educate people. So, doing cooking classes, whenever we host events, it's centered around that. We open those glass doors up. Usually, we have we call it paleo Mediterranean type snacks or foods that we offer folks that they come on the island and grab, and then we do the presentation from there. So it's really there to reinforce that message that you can do this with or without us.
Yeah.
Just this piece, just grab that piece and go, and you'll improve your life
Drastically.
exponentially. And then we can layer on all the other stuff, and that's part of the classes that I do every month. I do 8 classes a month. One is the backstory on why gut health is important and all the different impacts, how your microbiome gets out of balance in the translated way. I love taking in what you guys say and then putting it out here. But then the second one is how to live that type of lifestyle with sleep, with exercise, with nutrition, and making choices when you're traveling or when you're going out to eat or having holidays at home. So
I think the other piece of the
huge.
kitchen like that in the open is it's an accountability thing too for our employees and for ourselves. That we don't allow them to bring in junky food. We don't see the detailed people about one day a month they come in, and it's somebody that we still use. A person who we still use some of the things they have to offer, but they have some pretty strict boundaries about what they can bring in, and if it's junky stuff, they don't get to come see us. We won't let them in the building.
I need you to talk to my girls.
Yeah.
With their nerds
They're
clusters.
nerds.
Right.
Well,
We don't want. They can't
I mean,
see.
we
It's
don't
just
wanna-
like
yeah.
I have a
Nerd clusters.
I tell our team,
the hell
I
are
can't
those?
control what you all eat. I can't
Yeah.
control what you all do on your own time. But if you walk in this office, don't be carrying that big 24-ounce jug of Coke. or any of that kind of stuff. Put it in
Diet Pop.
put it
what
in
I'll-
a nice cup. But honestly, don't choose that for yourself. Look where
Yeah.
you get to work and take advantage of.
Yeah.
It's a matter of credibility. I mean, I've got several. I like looking at old 40s and 50s ads, and there's so many of them with doctors holding a cigarette, leaning over the table talking to their patient, or smoke Camels. It's good for your throat. These type of things.
But I will tell you that every
my
once in a while, back to just like a little bit of balance. Everyone says we all have. I'm going to assume you all have kryptonite, just a little bit of kryptonite somewhere, right? Something that I really shouldn't do this, but
Oh, yeah.
yeah. So we went to a pumpkin patch recently, and this is like completely anti everything I tell folks, right?
Yeah.
But kryptonite actually could be for me kettle corn. I don't know if you ever. Oh my gosh, kettle corn, which is so bad for you, right? Especially at a big GMO farm where that's GMO corn and it's got probably it's junky. I am sitting on the front porch of this pumpkin patch thing. I've got that
Just
kettle corn
housing it.
open,
She's
and I am
pounding
just
kettle
loving
corn, man.
it. Oh my gosh, it's like the best thing ever. And I know I'm going to feel like crap later on. And of course, a family of patients walks right up towards me, and I'm like, I knew what's going to happen. I mean, how could it not, right?
You've got to use the quick thinking of, hey, I'm about to just have a
Market research.
I'm doing a bowel prep right now. And
It was so funny, but I knew it was going to happen. But you know what? We're humans too, right? Every
Of
once in a while,
course.
you do stuff, and you're just like, I know this isn't in my best interest, but I'm choosing.
Well, I had a on the same trip had a grape soda, but it was with cane sugar.
Oh, geez.
But I had not had one of those since I was a kid, probably. But anyway,
He was sitting on the porch drinking his.
yeah,
Was it?
It tasted really
yeah.
good. I'm just gonna have to say
It was cute.
So I can tell you, my kryptonite is I've never ever had anything like a nerd cluster, and these girls. My girls, they have these things now and then, and I'm like, what's in that bag? And they're like, oh, you can't have this. And I'm like, why not? What's up with that? And I go, let me just try one of them. And you want to talk about shitting your brains out.
Oh, God.
I mean, my body is pretty attuned to good things. And you can't just have one nerd cluster. It's like, whoa,
addictive,
That's fun.
You got to eat at least like
I'm only going to do it today or for this
Yeah.
few minutes. And then you do a few and then you're like, is that bag still around?
Oh, yeah.
And then when you go home and barely make it home, and
That's
it's
rough.
not a shard, it's not how you think you can fart, but it's a
Bristol-
shard or
It's not a
something.
Bristol 4, right?
And you're like, oh, fuck.
Yeah.
That's a bad thing.
Well, and so here's the thing. So here's how we frame this, okay? Talking about how we frame things. Maybe for some of us in the past, that was just part of our normal repertoire, and we always felt crappy, no
Yeah.
pun intended.
Yeah.
Now, at least we know those things don't really serve me, but I'm going to make a human choice to enjoy that taste on my tongue or whatever
Yeah.
for a few minutes. And I know I'm going to feel terrible later, but I'm making a choice as opposed to always wondering, why do I always, this must be normal how people feel when they reach a certain age or whatever.
There is a little bit of a difference mentally when you're like,
Yeah.
I'm making a conscious decision that I'm going to eat this crappy food this one time because it's not a regular thing, and I know I'm going to feel like crap, but it's not going to alarm me. It's going to go in and out of my system, and that's just the humanity of it. And
Well, you think you could get by in it. Oh, I'm in such great, efficient tone that's not going to affect me at all.
Yeah.
And you're like, wrong.
Gotcha. Yeah. But for so many folks that we work with, and this was certainly my story pre-2008, we just think that's normal. This is how we always feel. This is how everybody feels, to always belly hurt, sluggish, all those things. Now, thankfully, when we educate people, they can start to learn the difference. This is how you should. This is going to serve you the best. But if you choose sometimes, now you're going to know the difference.
Yeah,
what
absolutely.
what an indicator though when you are constantly taking care of yourself and you do
Oh,
just
you
veer
know.
off the path real quick, and you can tell like, wow, this is
Yeah.
this is what it used to be every day, and
Oh, absolutely.
what it does to my body.
Immediate feedback, yeah.
Which is good to have,
Yeah.
right? It's that's a great point.
So Terry's performance protocol, kitchen's the heart of the home.
And
Take
we're-
care of yourself.
And
Eat.
tie that into that's one of the 3 pillars.
Yeah.
Diet, exercise, and sleep. I mean, she
Yeah.
jumped all over that. I mean, we cannot emphasize those things enough, right?
Dr. Paige, performance protocol.
Mine's honestly always sleep. I have to go to that with
there you
all
go.
patients. I mean, it's as soon as they walk in, I'll look at them and kind of make a sense of whether they look fatigued or not. 99% of the patients have to show me their airway, and I give them a Mallampati score, which lets me know what their risk of sleep apnea and adequate efficient sleep is, and take a history from them about, do they fall asleep? Do they wake? Do the traditional sleep history. And because if they don't sleep, they're not going to recover. It doesn't matter what we're doing. That's when their brain recovers. They get, their body does its work of recovery during sleep. So it impacts circadian rhythms and how their, whole system functions. So my favorite ones are the little kids that we see. We see kids with spectrum disorders and things and attention deficit. And many of them are going to have impaired airways. They don't sleep. They've never been diagnosed with sleep apnea, but they've got it. And you can just get so much headway by just getting that fixed and getting them to sleep properly and efficiently. Their brain works better.
For sure.
Yeah, I mean, it's just stunning. And you could do that and not even give them Selank. They would still, they're getting oxygen on their brain at night. I mean, that's probably, what else could you ask for? I mean, it's one of the basics of life.
Do you take any just holistic approaches like with natural light or helping them reset their circadian rhythm at all?
We do, try to get them to understand the impacts that light has on sleep, all of the artificial light exposures and the frequencies of light and, not getting appropriately grounded and making that photoelectric connection between them and the earth. And, we go through all of that with them to try to help reset that. But, from a practical standpoint, if they've got, anterior posterior narrow airway or giant obstructive adenoids and tonsils over it, doesn't matter what you do with the light. You got to fix the, it's airway, breathing, circulation. So if they don't have an airway, then it doesn't matter what you do with the rest of it.
I think you're right. That's one of the more profound things we see are the smart docs that have picked that up and had that taken care of, especially in the challenged or the spectrum children.
Yeah.
That's brilliant. That people don't look at those things. It's like, hey, my kid's agitated, my kid's on the spectrum. What are we going to do? And it's like you're actually looking at them and saying, okay, well, how are you sleeping? What's happening here? I mean, these are basic questions that make huge changes.
Instead of giving them Skittles.
Yeah. Well, if
Or
any of
clusters.
us, if we basically slept for 5 minutes, woke up for 10 minutes, slept for 5 minutes, woke up for 10 minutes. If you did that all night long, every night, you're probably going to be a little bit irritable and agitated and short fused and emotionally dysregulated and not able to focus and concentrate. I mean, it's
Look at me. Yeah, that happens. No, I mean, if I don't get sleep, look out, everybody, right?
Yeah, it's a simple fix.
Yeah, I know. They're essential.
It's very common. I mean, it's almost all of them have issues with it.
Doesn't it? I think as you get younger, like we are, that sleep component becomes even more important because you know how much that regulates your day and how it makes you either Superman the next day or it makes you want to be Skittle Man, or nerd. What is it? Nerd Cluster Man. or
Nerd
something.
cluster man. Yeah.
I haven't thought about nerd clusters in a long
Are
time.
nerd clusters and Skittles the same?
No.
Oh, that's bad then.
No.
There's more options.
Yeah.
That's really bad.
Yeah. Sometimes the girls have those sour Skittles. They brought them in the
My-
other week.
this isn't good. My team isn't looking good right now with this discussion.
The girls like their candy.
That's why Maddie's sick, right? She's been eating too many of those things.
Yeah.
Her husband got her sick.
Oh, you did. Okay.
Oh, Madison. But hey, it's been fun to have both of you here. And look at that, we filled the chairs. So
This has been awesome.
This is great.
Well, thanks for having us.
I got to take a second here and just close this up before I do my official closure and say, I can't thank you both enough for being part of my life personally in helping me be better at what I do and being more human, and helping me with this messaging with I don't know if people know, but Carl is my guy in the SSRP who's really been very loyal, been behind this whole process, and Terri has been there from day one, looking at all the things that we've done and still questioning me. Why, I don't know, but still questioning me. I can't say enough for you guys and what that's meant to me to help us build this platform of the SSRP, because I honestly I wouldn't be here if you guys weren't there to support me.
Well, appreciate that, and thanks for having us along for the ride. It's been a wonderful ride. I'm still looking forward to more. Yeah.
And we got a lot to learn, right?
Yeah.
That's what that's what keeps us young, right?
Right.
That's what keeps us young. It's that looking forward always instead of, here we are, 60s, blah, blah, blah. It's time to retire. Yeah, no.
This is the best.
Yeah.
I feel like it just keeps getting better.
I agree with you.
Right?
I agree
Yeah.
with you.
We
I'm
do,
grateful.
but I do want. I've told her. I said I want to work 3 days a week and be off 4 days and spend at least 1 month a year doing remote visits from Hawaii after we went to Hawaii.
You gotta love that.
Yeah.
You got it, Terri. You gotta love that approach, right?
Yeah, right.
That's
I
my
know.
goal.
Well, we've had a
But
lot.
not retirement. Yeah.
Well,
I'm
and we
not
were
interested,
talking
yeah.
about this actually just this
How
weekend.
can you retire?
Yeah.
It's
How-
like that's
yeah.
It's been fun
can't.
just to be part of your sphere and the broadening of horizons, the information, the knowledge, the experiences. So we're very grateful to you. So
Yes,
thank
we
you.
would have never been to a Four Seasons, and that's pretty shallow. But
That's just because I'm a fucking hotel snob. I won't go anywhere else. Then
I mean, just from a logistics point of view, it is a lot easier to convince people to come to a medical education training when it's, is it at the, no offense to the Hilton in Wichita, but no, is it the Four Seasons at a place where you actually really want to go and it is a big selling point for it. And the hotel chain has been excellent partners with us, and they give our people such good rates for what those rooms go for retail. So it's been awesome.
aspirational. Every time I go to Four Seasons, it's aspirational for me in terms of being a business person.
Yeah.
That's how I want our patients
We try to
feel
model our customer service
when they
off of that.
Yeah, we talk
So,
about, just
Right? You
know
Four
what?
Seasons level.
That's why we're there. That's
And honestly, to kind of tie it in a little bit to your performance protocol, because when you host an event, all of the food and beverage that you have to incorporate into it, the Four Seasons is on it when it comes to
the
food.
health. Yeah.
Yes.
They are.
And so, like, if we're going to host an event and be telling people, hey, you got to eat healthy,
We
the Four
actually do
Seasons
it.
backs that up.
Mm-hmm.
And that is a big reason why we continue to do stuff there.
Yeah,
It's all part of the quantum coherence of the whole process.
I like it. Yeah.
Let's not get back into quantums. Let's call it there.
Well, I think that's a wrap, and thank you for joining us for this 2-part episode of Redox Revolution with Carl and Terri. Thank you so much. Matt, thank you. And Maddie, sorry you weren't here. We'll talk to you soon.